Thank you very much, Nim. First of all, a big thank you to Nicola and Mario and everyone in the Sport Physio Swiss organization for inviting me. It's a pleasure to come over here to Bern and speak about shoulder injuries in elite football. And we might come back to this during my talk, whether there's actually a thing to be discussing. But anyway, here I am. So, first of all, let's start with this question. Is it dangerous to be a football player, an elite football player? And these two gentlemen in England, 17, 18 years ago, asked this question. So they compared what is the risk of having an injury as a professional athlete and missing time from work, missing training and matches, as compared to other high-risk occupations, such as industry, service sector, and so on. So if you're a factory worker, you can expect to have almost one work-related injury leading to time loss from work in 100,000 business hours. If you work in the industry, about the same. In the service sector, it's about half of that. And if you're Zlatan, 1,000 times the risk of having a work-related injury leading to absence from your work. Now, it might be possible to go to the industry work with a fractured ankle, but it's definitely impossible to play football. But anyway, it does show us a little bit what are the risks involved in being a professional athlete. So, what about if you're a semi-professional athlete? Maybe about 100 times the risk, possibly. Now, in a typical football team, even if you're more than a club, you can expect about 50 to 55 injuries leading to time loss in your club in a year. So roughly about 2 injuries per player on average. Some will have 0, some will have 5, 6, 7, and so on. But if you visit that club at any time during the year, you can expect that 14% of the players will be out of the squad because of injuries. 14% of the players unavailable for selection for games. Now, if you take that situation to a typical workplace, this is my workplace at Linköping University and the Division of Physiotherapy. We have 35 employees. So at any given time, we would have 5 employees absent from work because of injury. In Sweden, the health authorities would come knocking on our door and say, "You're fired." I'm sure it's the same thing here in Switzerland. So it's high risk to be a professional football athlete. Now, these are the top diagnoses that you would expect to see in professional football. A lot of the muscle tendon injuries from the hamstrings, the groin, the quadriceps, and the calf. The joint sprain injuries from the ankle and the knee, specifically the knee MCL. And also the tendinopathies you can see in the end. Now, can you spot 10 errors at a conference like this? Where are the shoulder injuries? Of course, there are shoulder injuries in football, and I think a lot of the shoulder injuries we see on television especially are these ones, the acute, quite traumatic injuries that occur in games, and we see them on various television networks. Now, shoulder injuries can have a major impact in a football game. So this is a Champions League final in 2018 between Liverpool and Real Madrid. And this quite high-profile player, Mo Salah, had a shoulder dislocation in the 25th minute. He had to be replaced, of course. Up to that time point, Liverpool had really dominated the game. But this situation really changed the match profile. Eventually, Real Madrid came up and won that game 3-1 and were the champions. I'm not saying it was only because of this shoulder injury of Mo Salah, but it definitely changed the nature of the game when he was replaced because of his injury. So injuries can have a high impact on team performance. This time, it was a shoulder injury. Now, I promise the rest of the talk I will actually speak about shoulder injuries. And I will speak some of the work that I have been involved in over the last 20 years with this football research group, which is an international research group based in Linköping in Sweden, where I come from. You will recognize some of the guys up here from conferences, and maybe you know some of them. And of course, Claire, wherever she is involved here in the conference as well. We have been running a large-scale injury surveillance study since 2001 in collaboration with the European Football Association, UEFA. We have invited Premier Division teams from all over Europe, so a total of 21 countries, to participate in this project. We've gathered quite a lot of injuries and amount of team exposures during these years. Now, I want you to pay attention to one thing on this slide, and that's the bottom line. What we register in our data is only time loss injuries. So injuries that occur during training in games and means that you miss a training or game. So this is important to remember. Also, when we speak about shoulder injuries and upper extremity injuries, it's important to separate by playing position. So for the goalkeepers to the left here, we can see that about 20% of all injuries are to the upper extremity, 60% to the lower extremity, some to the trunk, back, and head, neck. For the outfield players, it's only about 2 to 3% upper extremity injuries. So it's not a very common problem among outfield players. If you look specifically, if you're a Jan Sommer, you can expect about 9-10% of your injuries being directed towards the shoulder, some to the arm, wrist, hand, so totally about 19% upper extremity injuries. Some groin, knee, leg, ankle, and foot, of course. If you're an outfield player like Xhaka, it's dominated towards lower extremity injuries. So the ankle, the thigh, hip and groin, and knee. Only 1.5% shoulder injuries. So if you work as a physio for a professional club, you could expect to have roughly 50 time loss injuries during a season. Statistically, only 1 shoulder injury. If we look at the 18, 19 years that we've been running this injury surveillance study, there's really no trend among the shoulder injuries to go either up or down. There's some spikes here and there, and that's because there's so few shoulder injuries. But overall, it's quite stable. Now, if you're an outfield player, you can expect almost up to 2 injuries causing time loss per year. It's 0.014 shoulder injuries. So 1 shoulder injury every 69th season. Now, not even Zlatan Ibrahimovic will have a long career, 69 years. So statistically speaking, you're not likely to have a shoulder injury as an outfield player. Do you agree with this? Remember, this is time loss injuries, so I think probably you will have more problems than this if you work as a physio in a club. But this is time loss injuries. Now, as a goalkeeper, it's a little less, so about half total amount of injuries, but of course more shoulder injuries. So for a goalkeeper, you have 6-fold higher risk of a shoulder injury compared to outfield players. You can expect a shoulder injury about every 12th season. That might be realistic for a goalkeeper to have a 12-year career. Now, when we look at the severity of injuries, we can see that a lot of these injuries actually are quite severe. So about 1/3 of the shoulder injuries for goalkeepers are what we would label severe injuries, causing absence more than 4 weeks from training and match play. So even though they aren't very frequent, when they occur, they can be quite problematic. Quite a long rehab, actually quite a long high recurrence risk as well. So why the goalkeepers? Well, of course, you have these kind of situations. You're diving, you might fall on your shoulder, causing a sprain or dislocation, for instance. You stretch out, you reach for the ball. You throw the ball, importantly, as a goalkeeper. So there's also that you might be prone for more overuse tendon, muscle tendon injuries. So if we look at the injury panorama and we compare goalkeepers versus outfield players, we can see that among goalkeepers, it's a training injury. 2/3 of all shoulder injuries occur during training. During games, it's only 6% foul play injuries. We see the opposite among the outfield players. 83% match, and 1/4 of them are due to foul play. So when we are trying to prevent these injuries, the measures we have to do will be different among goalkeepers and outfield players. So maybe here we are speaking about changing the rules of the game or enforcing the rules of the game, fair play, and so on. Whereas this is more of a training problem. We also see quite a substantial difference in the way these injuries occur. So injury onset. 75% overuse or gradual onset injuries among goalkeepers. Outfield players, it's almost only acute injuries. Sudden situation where the injury occurs. Likewise, 75% non-contact among goalkeepers, reverse position outfield players, 74% contact. Again, preventive measures we need to look at, very different for goalies and outfield players. So among the outfield players in the red, we can see that 80% will be joint ligaments, so this sprain and dislocations, acute traumatic injuries. We have quite a few of those also in goalkeepers, but also a lot of muscle tendon injuries. So about 1/3 muscle tendon injuries. And if we look at the most common diagnosis, you can see that goalkeepers, rotator cuff injury, tears and tendinopathies. Quite common with AC joint sprain dislocations and shoulder dislocations and some contusions and also slap lesions. Whereas for outfield players, AC joint sprains, dislocations, and shoulder dislocations. Now, if we look at some other elite level football data from the nice work of Mario and Nasser Jungi and Jiří Dvořák, and also some of the stuff that we've been doing in European Championships, we can see that approximately 6 to 8% of all injuries during these major international tournaments are upper extremity injuries. Roughly half of these will be to the shoulder. So it's a little bit more prevalent during these tournaments than during the sort of league competition. It's because there's more games in quite a congested period of time. Some college football from the NCAA showed that similar to our data, there's a 5-fold increased risk for goalkeepers to have a shoulder injury among the boys and the men. There's a very high increase in training versus match, and it's also a pre-season training situation. Now the women, similar, 8-fold rate versus outfield players, but they also had twice as high prevalence or rate of shoulder injuries compared to men. So how does soccer or football, as we like to call it, compare to other sports? This is also college data from the US. We can see that over here, with the highest prevalence or incidence of shoulder injuries, you have the collision sports, football and ice hockey. You have the I want to break your arm sports, so wrestling up here. And then you have the throwing sports. And down here is soccer. If you look at some high school data, the same. Collision sports, breaking sports, throwing sports, soccer down here. So compared to these other sports, the rate of shoulder injuries in football is not that high. Now, is it a true injury burden? I'd say no. If we only look at time loss injuries, so hypothetically we can see here that these are all the injuries that happen to an athlete. A proportion of them will require medical attention, might be reported in some studies. And another proportion of them will lead to time loss from sports and be reported in studies such as ours. I think it's only the top of the iceberg. So I think the shoulder injury burden is actually higher than what we see in our data. Especially for an outfield player, you could definitely play with a bandage like this. And just as a disclosure, even though I'm not a shoulder specialist, I know that the shoulder is a little bit more proximal than the hand. So what about prevention and risk management? This tweet came up before the conference, attracted some discussion. Maybe it's because he was juggling on a Swiss ball, I don't know. Anyway, when we look at prevention, this will be a key topic, especially for the goalkeepers, to look at the load, the training load, and the type of training that you do. We have a large proportion of overuse injuries, training injuries among the goalies. Now, there's also a way to increase the capacity, of course, and we have these kind of training programs that we can do. So thanks to the work of Mario and Dr. Einesman and colleagues who developed the 11+ shoulder program. This would be something good to do for sort of the general population of football goalies in particular. We have these nice programs from handball, which is quite similar. We know that they work in handball. Do they work in football as well? Probably. We have some data from Martin Asker, who will present later on, of the handball studies from Stockholm. This also shows very promising results, similar type of training to reduce the prevalence of shoulder injuries. So to summarize my talk, shoulder injuries is not a very frequent condition in football, but when they do occur, they are often quite problematic and quite severe. I think the injury burden is probably underreported in studies where we only look at time loss from sports. Goalkeepers will have a 6-to-1 ratio of injury risk versus outfield players. And the goalkeepers will typically have training injuries, gradual onset injuries. Whereas the outfield players are more acute, they occur during matches and often due to contact. So thank you a lot, and importantly, congratulations for advancing to the Euro 2020. And even though we speak of handball and other popular sports, we all know this is what we want to see, right? So congratulations, and we'll see you in Europe. Thank you.